So next you're going to assess the ears. You're looking for symmetry. The pinna should form an invisible line with the inner and outer canthus of the eye. You're going to visualize the tympanic membrane using your pneumatic otoscope, and you're looking for otitis media and also patency of the membrane. So you're going to have the parent place the child in their lap and gently restrain the arms while you take your going to take the pinna and pull it up and back so that you can have direct visualization of the membrane. You're going to position your otoscope about 1/4 inch inside the ear canal and make sure that you stabilize it in case the infant moves, you don't cause any damage to the structures. And then you are going to assess for patency, and you're also looking for inflammation, indicating otitis media. You're then going to take the pneumatic otoscope and gently puff some air, and you should see some movement of the membrane. Next, you're going to assess the nose, mouth, and throat. You're looking for the nose to be midline and symmetrical. The nares should be patent, and you can do that by taking a piece of chilled glass and placing it under the infant's nose and looking for the condensation on the glass. You shouldn't have any nasal flaring. That's indicative of respiratory distress. The throat assessment usually should be deferred until later, but if the infant is crying, you can go ahead and do that assessment. You're looking for a deviated uvula or any obvious signs of a cleft palate or lip. The mucous membrane should be pink. And you want to make sure that there is no asymmetry of the nasal folds or of the nasal bridge. Also, that can be indicative of fetal alcohol syndrome or a chromosomal abnormality. Next, you're going to do the thorax and the lungs. You're looking for symmetry. There should be no retractions, there should be no accessory muscle use or any other signs of respiratory distress. You're going to go ahead and auscultate all the regions of the lung sounds, front, side, and back, and they should be clear. You should see brisk capillary refill of the extremities and also absence of cyanosis. However, if there is some circumoral cyanosis while the infant is crying, that can be normal, but there should be no central cyanosis. Next, you're going to assess the vascular system. You're going to auscultate at the PMI and also over the neck veins. You're listening for murmurs and bruits. Some murmurs can be harmless and go away as the infant grows older. You're also going to assess the peripheral pulses. You're looking for brachial, radial, and also pedal pulses, making sure that they match the apical rate of the heartbeat, and also looking for strength of the pulse and making sure that they're the same from the upper extremity to the lower extremity. If there are diminished lower extremity pulses, that can indicate a coarctation of the aorta or another heart defect.